So again, you got to have a system here. Let's start over here. This is diastolic filling. As you can see, the end diastolic volume is the same. So you filled it the same amount. The preload is the same. So then if we go through here, isovolumetric contraction, this is where the aortic valve would open. And as you can see, it's about the same to increase the aortic valve. So I would say this is already looking like this is probably not our answer choice, because for aortic stenosis, when we get to the right answer choice, you'll see this line will be dramatically increased. Where this breaks off, it'll be dramatically increased. And so what you see as we go from during systolic ejection, you see dramatic increase in pressure. And then if you follow it all the way along here, what you see here, down to the end of systole, where you have the end systolic volume, the end systolic volume is decreased. So you have a decrease in end systolic volume. And so if you remember, the distance from across the pressure volume loop corresponds to the systolic volume. So if you've decreased end systolic volume and end diastolic volume is the same, as a result of that, you've increased the systolic volume. So if you look at what's happened here, you've dramatically increased the pressure, and you've gotten a nice result from that. From increasing the pressure, you were able to eject more blood. So increase in the amount of blood ejected. And so what that corresponds to is actually what's called increased contractility. So that's what this PV loop corresponds to, is increased contractility. And during increased contractility, you have increased tension and increased pressure in the left ventricle, and as a result of that, you're able to eject more blood, and as a result of that, you have a decreased end systolic volume and an increased stroke volume.